We had, unfortunately, 390 cases of community transmission. Some are still under investigation, but at least 60 of those have been infectious in the community. And I anticipate, given the large number of cases we've had in the last few days, that unfortunately this trend will continue for at least the next few days. So it means all of us have to work harder to make sure we stay at home and follow the rules. Tragically, 2 people lost their lives overnight because of COVID. One woman in her 40s in southwestern Sydney who died at home tragically. She wasn't vaccinated, and we extend our heartfelt condolences to her loved ones and extended family. There was also the tragic death of a man in his late 90s in the Hunter, New England area. He was vaccinated but also under palliative care. Again, our heartfelt sympathies and condolences. I know that every day when we read the statistics about the deaths, we often remember or don't remember that behind every single statistic is a loved one, a family, and many carers. So we extend our heartfelt thoughts to all of them. The main challenges remain Western Sydney and southwestern Sydney, and whilst again we've seen an ongoing stabilisation in Fairfield and Canterbury-Bankstown still has the highest number of cases, but we have seen a stabilisation and the cases aren't growing the way they were in the last few weeks, which is a positive. But the health experts have asked me to highlight Blacktown and Mount Druitt as areas of concern and adjoining areas. So we're really wanting to make sure that people living in Blacktown and Mount Druitt and those adjoining suburbs come forward for testing, stay home, and if they haven't already got vaccinated and they don't have symptoms, to come forward and get vaccinated. Unfortunately, also around the Dubbo region, Dubbo in Western New South Wales is becoming a big challenge health-wise with 25 cases overnight. And of course, the New South Wales government has been liaising with our federal colleagues as well to make sure we get support to those communities in Western New South Wales and far Western New South Wales. Hunter, New England had 5 additional cases, which is an improvement of the last few days. However, pleasingly, Tamworth, Armidale and Northern Rivers had no cases, which is pleasing. However, obviously, we're not out of the woods in those areas given there were those exposure sites. This Sunday we have a bumper day of vaccinations for tradies and construction workers. There's already around 10,000 people who've booked throughout those locations, and I just want to stress that the one location in Prairie Wood will maintain its status as a walk-in centre. So if you're a tradie or a construction worker, you haven't already got a jab and you haven't booked anywhere or won't be booking by that day, you can walk into the Prairie Wood Centre and get the jab as well. And that's pleasing that the construction sector and tradies have been very enthusiastic about coming forward and getting the jab, and certainly getting back to work safely has been an incentive for that group of workers. Pleasingly, from Monday next week, 100,000 authorised workers aged between 16 and 39 years of age in those local area governments of concern in Greater Sydney will be getting a jab. So through their workplaces and through other points of contact, they'll be sent invitations. So over and above what we're doing already, 100,000 authorised workers, and we know that workplaces and households remain and continue to be the greatest source of infection. We know there's categories of workers that just can't stay at home because of the important work they do, whether it's in healthcare, whether it's in getting food on our table. They must work, and knowing that they're going to get vaccinated gives us that greater degree of confidence in trying to reduce the spread, but also in making sure people stay out of hospital, and that's what we need to ensure.